Now it's my pleasure to welcome Sheila Mary. At Aging and Disability Services, we're so fortunate to have such an accomplished medical professional join us as a graduate intern this year. Sheila, thank you so much for being here today. Please unmute your microphone as you're now live.
Good morning. Thank you, Lenny. Good morning, everyone. You may be asking yourself right now, why are you looking at slides that have no connection whatsoever with my presentation? Lenny, thank you very much. And again, another surprise. I know you are expecting to see pictures of mouth, smiles, teeth, and now you are looking at pictures of hats, cats, and flag. I like to make fun of myself by calling me a cat with 7 lives, all lived in one lifetime. And you are going to see why. And I have each hat for one of my lives. The first one, I was born and raised in Haiti, and my native languages are French and Haitian Creole, which explain my strong French accent. That's one life. The second one, I am a medical doctor in Haiti, and I am also a dentist in Haiti. That's 3 lives. I spent 7 years working in Florida as a dental hygienist. And now I am again a student, which is my 5th life. In like about 4 years ago, I moved to Kenmore, Washington with my family to start a new life of student at Bastille University. Hopefully, I am knocking on wood. That's the last time I go to school. I am doing a dual track where I'm studying naturopathic medicine and public health, and I am 38 days away from having my master's in public health. Woo-hoo. I am also part of my student life. I am also a student intern at Aging and Disability Services. My 6th life is that I am a wife, a mother of one, and a stepmother of 2, and we all live together. And about my 7th life, do you know what I like to do in my free time? I love to dance. And actually, while in quarantine, my husband and I have been having those dance party at home every Saturday night. We put on music, we got dressed up like we are going out, and we just dance. That's my favorite thing to do when I am free. Now that you know 7 things about me, let's move to business. Next slide, please. Today, we are going to talk about a healthy mouth for a healthy body. A healthy mouth for a healthy body. But before I even dive into the subject, next slide, please, I need to read you a disclaimer. This presentation is part of a health education program. It is not intended to diagnose or treat any disease. Always contact a healthcare provider, aka doctor or other providers, for diagnosis and treatments. Next slide, please. We are going to talk about why oral health matters, condition that may affect your oral health, and also condition in your mouth that can also affect your body. We are going to talk about the importance of food in your oral health and your habits. We will talk about the importance and timing of dental visits, how to achieve and maintain good oral health, and how to afford dental care. Next, please. Uh, no need to really enter in all the details I list here, but I have to tell you that all conditions are very common. 1 in 4 US adults aged 65 or older have lost all of their teeth, and more than 7,800 people, mostly older Americans, die from oral and throat cancers each year. Moving on. Next slide. Did you know that the mouth is, the question may seem funny, but I'm going to ask it anyway. Did you know that your mouth is connected to your body? People tend to see their mouth as something isolated. And one of the reasons is like we know there are doctors for teeth, and they go to separate school, and they have doctors for the rest of the body, and they all go to medical school. But the mouth is not only part of your body, but it's also the door, one of the doors of your body. Everything that goes to your mouth go to your system, go to your blood, and may also affect other part of your body. And also, many conditions or sicknesses or illnesses that you may have may also affect your oral health. Let's name as few: diabetes, osteoporosis, rheumatoid arthritis, certain cancers, certain illnesses that affect your immune system, like depress your immune system, Alzheimer's disease, AIDS, HIV, and eating disorders. Next. Medication that you take may also affect your oral health. And we have a long list of medication, but let's point the medication that cause dry mouth, such as some blood pressure medications like nifedipine, verapamil, amlodipine, some medication that you may use to treat or fight cancers, medication for seizures, painkillers, muscle relaxants, Parkinson disease medication, some of them, medication for asthma, and long-time use of sugar-containing medications. Next slide. Another fact: did you know that your mouth is the house of several microorganisms? Yes, unfortunately. Each of us have about 300 species of germs living in our mouth. And those germs are living organisms. What they do, they feed themselves from your food, they grow, they develop, they multiply, and they produce also waste. Those waste products attack your teeth, and that's how you may end up having cavities, like whole black spot on your teeth. Those wastes also may attack your gum and make your gum swollen, inflamed, which we call gingivitis. And gingivitis, when not treated, may progress to periodontal disease. That's when not only the gum is swollen, but also the bone that support your tooth is also affected, which may destroy the support system of the teeth and cause loose tooth, and you may end up losing your tooth in the long term. Those germs can also create other level of infection that can end up giving you dental abscess. Next, please. I wish I could tell you that the germs in your mouth only stay in your mouth. Unfortunately, that will not be true. The germ in your mouth can move to your heart and cause very serious disease of the heart, such as inflammation of the heart chambers or valve. They can cause your arteries to clog, and they can even lead to stroke. Those same germs can also move to your lungs and give pneumonia. And in pregnant women, those germs can cause premature birth and low birth weight. Then you can see how the mouth is really connected to the overall health. Now, next slide, please. Thank you. Now, how can we achieve good whole health? The good news is, like most of the sicknesses of the mouth are infections, and infections can be prevented. That's good news. So, how can we prevent to have infections in our mouth? The first thing is to brush at least twice a day. And twice a day, morning and night, and never forget about the nighttime brushing. And I'm going to tell you why. The germs living in your mouth, in our mouth, are more active at nighttime than daytime. So, picture this. When you go to bed without brushing, it's like you set a nice table full of food and you ask the bacteria, the germs, to come feed themselves so they can be strong to destroy you. And I hope you will remember that, to also remember brushing twice a day and never forget the nighttime brushing. Are all toothbrushes equal? No. You need a toothbrush that is able to do the job. That is why it is recommended to change our toothbrush every 3 to 4 months or even sooner. And how we can know if we need to change it before 3 months is by checking the toothbrush bristles. The little thing that you see you brush with, the bristles. As soon as you see those bristles going separate ways, it's time to change your toothbrush. And even if it's not 3 months yet, it is time. Is the toothbrush enough to do a good job in brushing? No. You also need to use a good toothpaste. And we recommend toothpaste with fluoride in them. I know there are several concerns about using fluoride in the mouth. I am not going to enter in these details right now, but I can tell you, if you use just a pea size, the little green pea, If you use just a pea size on your toothbrush, it is safe enough to do a good job. There is no need to fill the whole brushing surface with toothpaste, just a pea size. Now let's talk about the timing. How long should you brush your teeth? Every day, twice a day. Let's remember the rules of 2 by 2. You should brush twice a day and 2 minutes each time. That's the rule of 2 by 2. Technique for brushing. I wish I was live with you to demonstrate a proper brushing technique, but we are going to use words and images for now. First, you need to brush your teeth by opening your mouth. Don't keep your mouth closed. Don't keep your teeth together to brush your teeth. You should open your mouth and brush from pink to white. What I mean by that, always start from your gum and go toward your teeth. By doing so, you will protect your gum and keep them attached to your teeth as long as possible. I know there is another technique of doing like round motion on the gum and teeth. Personally, I don't like that because since we are not monitoring the pressure that people use to brush their teeth, they may, by doing those circles, also detach in the long term the gum from the tooth. That is why the safest way to go is to go from pink to white. And also, never forget to brush your tongue as well, because your tongue also can host many germs. Next slide, please. In this slide, I am showing you like the different position to brush your teeth. And one thing that I wanted to show here, that we should brush all the surfaces of our teeth. The surface that is outside, the one that people can see, the one that is inside that your tongue can touch, and also your chewing surface. All of them should be brushed during your brushing routine. Next slide, please. Now, I just told you that we should brush all the surfaces of our teeth. But remember, toothbrush cannot go between teeth to clean that space. The only way to clean the space between our teeth is to floss. Again, there are different techniques of flossing. And since I cannot in person train you right now about the proper way to floss, I will recommend that the next time you see a dentist or dental hygienist, to ask them to teach you the proper way to floss. There are also many video on YouTube where they teach people how to floss. I would recommend that you look for video that was done by doctors or dental school. Those are more reliable. Next slide, please. Even when we are right on the job, brushing twice a day, flossing at least once a day, doing everything that we can do at home, there will always be some leftover stick to our teeth that the toothbrush and floss cannot remove. This is why it is recommended that we go see a dentist at least twice a year so they can check our teeth to see if everything is okay, and do or prescribe their hygienist to do a professional teeth cleaning, because the machine they use is the only one that can remove hard collection that the toothbrush couldn't take care of. So remember to see your dentist at least twice a year, and to make sure that you have a dental cleaning done at least twice a year. Next, please. Now, how can you use food, your diet, to strengthen your oral health and your teeth? Again, I told you that your mouth is part of your body and everything is connected. When you are on a healthy diet, you are giving your body the nutrients and vitamins that your body needs to be strong, for your bones and teeth to be strong. And you are also strengthening your immune system to allow them to fight infection. Then a healthy diet is part also of a good oral hygiene. Food that help a good oral hygiene, food rich in calcium and phosphorus, low fat or fat-free milk, yogurt, cheese, canned salmon, other fish, eggs, dark green leafy vegetables, tofu, nuts, and beans. Do your best to avoid sugary snacks such as gummies, bagels, juice, which stick to your teeth and also strengthen the germs in your mouth. Instead, choose healthy snacks such as fruits, nuts, vegetables, whole grains, and lean meats. Next, one thing that I hear people reporting very often is the fact that they cannot afford dental care. And at aging and disability services, we spend sometimes trying to look for solutions on how we can help people afford dental care. There are three ways to afford dental care. One is to go with the self-pay option if you have money to do so. The other option is to use your dental insurance. But the issue here is many, even like too many, almost all of them, do not offer a good enough dental coverage. One thing that we found out for older adults, if you are an older adult on Medicare and you have a monthly income of $1,350 or less per month, there is a possibility for you to add a Medicaid advantage on your plan so you can have access to basic dental care. And if you need more information on how to do so, you can either contact your Medicare state agency or call Community Living Connection at 1-844-348-5464. Again, 1-844-348-5464. Next slide, please. This is all I had planned for you today, and I thank you for your attention. I thank Community Living Connection for allowing me to be here today and to present this topic with you, and I am open, I'm available for your question.
All right. Thank you so much, Sheila. So for our online viewers, now is again great time to type anything that's on your mind in the moderated Q&A. In the meantime, we do have folks there in the live studio. Well, it's a live studio audience that we're going to open up the line to in just a second to see if you have any thoughts, comments, or questions. All right. So as I am now, if you'd like, you can make a comment. You're on the show. And you may need to unmute your device, your phone, if you had muted it earlier. Or if you don't have a comment, that's fine too. I'm going to mute the conference again and go over to Michael Taylor Judd to see if there are any comments there in the Q&A online.
We do not have anything queued up yet.
All right. Thank you, Michael. Well, actually, I have a question. So now that there is a phased reopening of the state of Washington that's happening, Sheila, I was wondering if you could speak to where can folks get, dental care that's not emergent. Let's say it's not, somebody's tooth falling out or a lot of pain. Something like a twice yearly cleaning. Can they still get that scheduled now during the time of social distancing?
Based on the information that I have so far, I don't think we are opening non-urgent care at the moment in Washington. We may have to double check that information, but this is what I have so far. I think they will open urgent dental care, but I'm not sure if they will open non-emergent dental care yet.
All right. Thank you for that update. Looks like Michael isn't. I think there's a comment
Yep,
there in the Q&A.
We have a question here from Mary Pat again. She says, "Thank you, Sheila, for a fantastic presentation. What would you say to a person who is afraid to go to a dental provider because they are embarrassed or worried about what the dentist will say?"
Thank you, Mary Pat, for your question. Before I answer, I also have to thank Mary Pat for her mentorship to the whole year. And I like to say that I was very blessed to have a mentor like her who took me under her wing and gave me the best of her many, many, many years of experience. So I want to thank Mary Pat for that. About fear of dentists and fear of judgment, I can understand where people stand on that. But one thing that I think we should put in mind, that dentists are supposed to be trained professionals who have the right amount of training to make people feel comfortable. I cannot speak for all dentists, but I can speak about the training that we receive. We are trained to see sickness not as a subject of shame, but as a condition that happen into people's lives and that we are chosen to take care of. And I will advise people to not to suppress their emotions and feelings, which may end up causing other issues, but to be upfront about it. To say, "Doc, I am here today, but I didn't want to come because I feel ashamed of what you may say." Just be upfront with it, and you will see how the dentists handle your situation, how they make you feel comfortable, and how they make you feel at home so you can little by little move away from your fear.
Thank you. Our next question says, Sheila, could you share a success story from your dental experience? Does any specific story come to mind?
I have several. Okay. One thing that I loved about being an hygienist uh, is the immediate feedback that you have from your patients. Like as a dentist, I often had to wait for many weeks to complete a treatment and to see results. But as a dental hygienist, I could see right away the change that I was working on. And I have seen people coming with me, as Muripat said, with shame and leaving very happy, smiling because they could see the difference. Because for a good dental cleaning, you will see the difference, especially like if it was a challenging case. And I love challenging cases. I love to feel that I am making a difference, which may seem kind of weird, but I like when people come to me with like a challenging oral health status, and in 1 hour, they can see in the mirror a different smile. That's what I loved about my time working as a dental hygienist.
All right, thank you. And we have one, probably time for one more question. So the next one that came in here says, I struggle with remembering to brush at night. Any suggestions to help me remember?
Okay. What I can say about remembering, if you use an alarm, maybe you can set the alarm for the time that you know you go to bed. Like if by example you go to bed every day at 10 o'clock, maybe you can set an alarm at 9:30 to remind you to brush your teeth. That's one thing that I have in mind right now. And also one thing that I forgot to say, sometimes people come from work, they take a shower or bath, they brush their teeth, and then they have dinner. They still brush twice a day, and they still brush at night. But the nighttime brushing should be the last thing you do before you go to bed. You cannot take a snack after doing it. That is why it's better to set an alarm for right before your bedtime, so it can be the last time you do before you go to bed. Personally, I struggle with remembering flossing at night because I floss once a day, usually at night, and I tend to forget. What I've been doing is to put the floss in my nightstand table, so it's right there. Even when I am tired, I can just reach out to it and then floss while in bed. It and I know it requires like a level of comfort because I'm not watching what I am doing, but this is what I've been doing. So try to find your own rhythm, what works for you, and if you can use an alarm to remind you, that will be the good thing to do.
All right. Thank you, Sheila. Thank you so much for being here today. You know, all the best to you in getting yet another medical degree. That's amazing. So many hats, so many lives. And thank you for sharing those, especially one related to dental oral health with us today.